Welcome, everyone. Thank you for joining the NIOSH Total Worker Health webinar series, Yoga and Meditation for Worker Wellbeing. We are very excited to present this webinar to you today. Free continuing education credits are available for this presentation through the CDC's CDC Train. We're pleased to be able to offer the following continuing education types listed on your screen. Detailed instructions on accessing the CDC Train site are available for download at the website on the top of your screen. You can go to www.train.org/CDC-Train. And note that the bright blue activity number is only valid for those watching the live webinar, and you'll need the course access code to receive this credit. The gray activity number is to be used only by those viewing the webinar or attempting to access continuing education after July 1st of this year, 2024. We are recording this webinar and plan to post it on our CDC YouTube playlist for those who couldn't join us today. You can also find more information about our webinar series on our webinar page. So today we are excited to have Dr. Sat Bir Singh Khalsa and Stuart Rothenberg. Dr. Khalsa is the Director of Research for the Kundalini Research Institute and Associate Professor of Medicine at Harvard Medical School. He has conducted scientific research since 2001 on yoga for insomnia, stress, anxiety disorders, and in workplace and school settings. He's been a practitioner of instructor of Kundalini Yoga since 1973. He coordinates the International Association of Yoga Therapists' annual symposium on yoga research and is editor-in-chief of the International Journal of Yoga Therapy, medical editor of the Harvard Special Report Introduction to Yoga, and chief editor of the medical textbook, The Principles and Practice of Yoga in Healthcare. Dr. Rothenberg is National Medical Director of the Transcendental Meditation Health Professionals Association and Chief Medical Officer of the David Lynch Foundation. Dr. Rothenberg was one of the first physicians in the US to be trained as a teacher of the Transcendental Meditation technique. Since April 2020, Dr. Rothenberg has headed up the Heal the Healers Now program, a national initiative which offers training in the TM-based healthcare provider wellness program to frontline healthcare workers. This program's been implemented in over 90 hospitals and medical centers nationwide and researched in 7 peer-reviewed published studies to date. Before we begin, for those new to this webinar series, I'll quickly define total worker health as policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker well-being. It refers to strategies integrating protection and prevention. It combines the mandate of safety and health protection with the opportunity of advancing worker well-being. And with that, I will ask Dr. Khalsa to share his screen to kick off our presentations today.
Okay. Well, thank you very much for that introduction. It's a pleasure to be here. And what I'm planning to do is to start with a description of one of the major risk factors for health in modern society, and that really is chronic stress. And what I want to do is talk about the prevalence of chronic stress in modern society, and then talk about how that also has impacts with respect to the workplace. And then I'll finish off talking about the rationale for how yoga is an excellent strategy for managing chronic stress, improving resilience, and even treating burnout. And then show you some of the published research evidence that supports that. So stress, as I said, is really very common. It's an international phenomenon. I think it's pretty safe to say that we have an epidemic of unmanaged chronic stress in modern society. If you even look at modern US media, It comes pretty clear. This is the cover of Time magazine. Stress Seeking Cures for Modern Anxieties, the cover of Popular Science. Stress, It's Killing You, How to Beat It with Science. The cover of Newsweek, here on the left, You're Right, Stress is Making You Sick. And then Scientific American Mind, The Two Faces of Stress, A Little Pressure Improves Memory, Learning. Too much has the opposite effect. And one of the things about unmanaged chronic stress is that it's one of the major risk factors for most all psychological conditions and even many physical conditions, for example, low back pain. Now, we do have surveys that have been done demonstrating how prevalent this level of managed chronic stress is, and these come from the American Psychological Association, which for many years has been conducting an annual Stress in America survey. And from 2022, what they found was that 27% of all adults in the US said that most days they are so stressed that they can barely function. That's a pretty dramatic statement, to be so stressed that you can barely function. And if you look at the major workplace age from those under 35 to 44, that's in the 40% range. And for those who are minorities, for Black adults, it's 56%. So this is really a strong percentage of the population that is experiencing very high levels of stress. Now, just to show you some later statistics, this is from the 2023 survey, and this stress is not abating after the pandemic has passed. Nearly a quarter of adults, 24%, rated their average stress between 8 and 10 on a scale of 1 to 10. This is up from 19% in 2019 before the pandemic. So yes, there was a spike in stress during the pandemic, but even compared to before the pandemic, the 2023 statistics are showing this continuing increase in chronic unmanaged stress. Now, in terms of the workplace, there's another phenomenon that occurs that's really a form of stress, and it's called burnout. It's becoming very well known. This is a nice definition of burnout. It's broadly understood as a psychological state of exhaustion stemming from persistent exposure to work-related stressors, while lacking sufficient resources to efficiently cope with these stressors. More precisely, burnout is typically operationalized as a work-related syndrome encompassing at least three distinctive yet interrelated components: exhaustion, cynicism, or depersonalization, and a reduced sense of professional efficacy. When individuals experience burnout, work that was once seen as challenging and meaningful becomes increasingly unfulfilling and unsustainable over time. And the whole construct of stress and burnout in the workplace is not unrecognized by our federal agencies and even by international agencies. This is the World Health Organization on this webpage talking about stress in the workplace, what it is, what are some of the consequences of unmanaged stress in the workplace. And of course, the CDC and NIOSH, this is a page talking about stress at work. There's a blog on stress at work. They're talking about the consequences of stress in the workplace. And one of the places that we know that stress is high is in stressful occupations, first responders, and the healthcare system. And so this is the Agency for Healthcare Research and Quality, and physician burnout has become a major issue in the field of modern medicine. In fact, this is from the Harvard School of Public Health paper on the crisis in healthcare in terms of physician burnout. This was published in 2018, again, before the pandemic. The prevalence of physician burnout has reached critical levels. Recent evidence indicates that nearly half of all physicians experience burnout in some form, and it appears to be getting worse. And one of the alarming statistics is that the suicide rate among physicians is over 400 per year. That's more than one per day. And so this is a really serious problem in the field of modern medicine. And it is still with us. This is from a paper published in 2024 talking about the prevalence of burnout. Burnout prevalence is a significant challenge for public health across the United States and around the world. Our findings identify the immediate need for interventions for the prevention and management of burnout among public health professionals, as well as the allocation of resources to address burnout. And in this figure, you can see for some of the countries that they're reporting studies on, in the US, that prevalence is 66%, in a number of countries, 51%, Ireland, 66%, and even in China, it's 68%. So high levels of burnout. So now I want to turn to how do we deal with this? And really, there are no sort of easy medical psychological answers to treating stress. There's no pill for chronic stress. If there was, doctors wouldn't be under stress and burnout. And so what I want to introduce to you is a mind-body practice that we call yoga. And everybody knows what sort of yoga is from the physical perspective. It's these postures and exercises, some of which you see in this slide here. And certainly these postures and exercises are part of yoga. They are very relaxing exercises. They're more focused on flexibility, isometric exercises, twisting, inverted postures, etc., which tend to be a little bit more relaxing than our Western aerobic type exercises. However, yoga is more than just physical postures and exercises, although there are many styles of yoga in the US that are just postures. But traditional yoga also incorporates breathing techniques, especially the long, slow, deep breathing practices, which by themselves are known to have very powerful effects on our psychophysiology. There's also deep relaxation practices in yoga, typically this progressive relaxation, supine relaxation. And a very important component of traditional meditation is meditation, which most simply defined is the relaxed, non-analytical focus of attention. And there are many different styles of meditation, but all of them have a potential benefit through this action of focusing attention. So what I'm talking about in this presentation is really sort of the evidence for traditional yoga that incorporates all of these components. And that's one of the strong advantages of yoga in that it has these multiple components, which provides multiple avenues for getting benefit, but also gives people a sort of smorgasbord, if you will, of choices. If people want to gravitate more towards the meditation or more towards the physical postures, those options are available in this particular type of mind-body practice. Now, yoga is becoming very popular in modern society. These are statistics from the federal government in the US, and what you can see is this remarkable increase in the prevalence of the number of US adults who practice yoga over the past year. In 2022, that was almost 16%, which is a major movement in society whenever you talk about 16% of the population doing anything. So it really has become a very American type practice. The other thing that has increased apace with that increase in popularity is research on yoga. And this is taken from the PubMed medical research database, looking at all of those papers which are review papers or meta-analyses of many yoga studies. Which really sort of represents a sort of a collective review of many different studies in different areas. And what you can see is this remarkable trend again. In 2000, there weren't any published, and in 2023, there were over 60 papers published. That's more than one per week. So we're seeing a large increase in the amount of research that's been done on yoga. And this is yoga for different psychological and medical conditions, but also evaluating how yoga works. And so this slide shows some of these papers which really have addressed the research that's been done showing how yoga works on our minds and our bodies, the so-called psychophysiology of yoga. So for example, here in this review, how yoga practice and therapy yield psychological benefits, the known effects of yoga on the brain in relation to motor performances. Below that, how does yoga reduce stress? At the top, yoga and immune system functioning. Below that, neurophysiological, neurocognitive mechanisms, stress again, and then potential self-regulatory mechanisms of yoga for psychological health. So this is giving us an unprecedented knowledge about how yoga works. And that allows us to take that information and then, strategize as to what the benefits are for different types of conditions and populations and circumstances. And what I'm going to show you now is a logic model, which really summarizes a lot of this research that's been done. So again, as I said, yoga is not just the postures and exercises, it's also the breathing techniques, the relaxation, and the meditation component. And what we know is that through each one of these practices, either by itself or together in some combination of yoga, we have an effect on the physical body. And that's this box I'm calling sort of physical fitness, if you will. Things like flexibility, strength, coordination and balance, respiratory function, which leads to an overall self-efficacy. And through the mind-body connection, relaxing the body does create a psychological relaxation and stress reduction. We also know that through each one of these practices by themselves or together in some combination in yoga, we are able to self-regulate internal state. We'd be able to control our internal functioning, both psychological and physical or physiological. And the most important things that we can self-regulate are stress and emotion, because these are the two things that affect psychological health substantially. And with practice over time, these lead individuals to increased resilience and tolerance to stress, and increased emotional equanimity, being able to ride the emotions of life more effectively. And that leads to an overall self-efficacy, functioning better in modern society with all of its stressors and challenges. We also know that it's primarily through the meditative component, this relaxed, non-analytical focus of attention. We engage the attention networks of the brain when we do this. And when we do this, we get better at regulating the attention networks, and we become actually more attentive. And this increases our mind-body awareness, which is also now known very popularly as mindfulness. And this improves our cognitive functioning, our concentration, but ultimately leads to a state of metacognition, which is a state in which we have more ability to self-regulate our thought processes. And this ability to self-regulate our thought processes is really at the heart of stress and emotion regulation. And then finally, for many people who practice yoga more regularly over a longer period of time, people do start to experience these deeper meditative states, these unitive states, experiences of transcendence, a sense of flow, which leads people to a sort of a deeper transformation and an improvement in life meaning and purpose. And I've put this in a box that I'm referring to as pure spirituality. And so one thing you can see from this model is that we're making changes across a broad spectrum of human functioning. This leads overall, over time, to global improvements in human functionality, from the gross level of physical and mental health and performance to improved stress and emotion regulation, improvements in awareness, mindfulness, and the induction of this state of metacognition, this ability to self-regulate our own thought processes. And ultimately, over time, with longer practice, people start to experience these deeper things, positive behaviors, improvements in well-being, life values, life purpose and meaning, and even the sense of this deeper life meaning and purpose or spirituality. So there is evidence of yoga in the workplace, and this is a very strongly researched area recently. And this is evident by a number of review papers that have been published summarizing this. This is a paper published in 2019, Yoga in the Workplace and Health Outcomes, a systematic review. The findings of this study suggest that yoga has a positive effect on health in the workplace, particularly in reducing stress. And if I had to say what is the most strong outcome from that logic model that I just showed you, it really is this ability to manage stress and emotion. This is another umbrella review. This is actually a review of the reviews that have been published. So we're sort of building this pyramid of evidence supporting this. And from this paper, they concluded that in accordance with the literature, the study shows that increasing the use of yoga and mindfulness-based interventions can provide support to healthcare workers in achieving stable psychophysical well-being, which can enhance their value within their work environment. And what I wanted to do to close is just share with you some of the studies that have been done by myself and my colleagues. Our early work was done actually at a police academy training institution in Massachusetts. And this was just a single group trial where the cadets were exposed to yoga practices for 6 weeks. And we were able to show that scores on the perceived stress scale were statistically significantly reduced, and mood disturbance was also reduced in a number of different facets, including tension and fatigue. We also did studies in Wales in the UK, and this was a clerical building of healthcare workers and healthcare clerical workers. And we showed a number of different improvements. This was a randomized controlled trial. The control group had little change. These are the open bars. The yoga group and the dark bars showed improvements in anxiety, depression, feeling energy, and so on. And then importantly here, self-confidence during stress was increased in the yoga group after 8 weeks, but the control group really had no change. That study was done again in another similar population. That time we used the perceived stress scale. Again, an 8-week intervention. You can see the controls really had little decline in perceived stress, but the yoga group had a nice statistically significant decline in perceived stress. More recently, we've been working with the Kripalu Center for Yoga and Health, and we held, to start off our research, we had a program called RISE, which was designed to be used in stressful workplace populations. This was a residential program that is shown in this slide here, a 5-day program. At the end of the program, after they left, they had a reduction in perceived stress and an increased resilience. And of course, that's no surprise when you go to a retreat center. But what we found was that there were still residual improvements in perceived stress even 2 months after they were back in their regular work environment. And their increases resilience to stress also held up over that period of time. The other thing we showed that this construct of mindfulness was also increased, their ability to be aware of their own internal state. And of course, being aware that you're stressed is the first step in being able to manage stress. So this whole improvement in mindfulness is very important. And in fact, what we're starting to see is that mindfulness really is one of the mechanisms that's really associated with these improvements in stress management. We also looked at a population of education professionals, mostly teachers, again, a very stressful occupation. This was a randomized controlled trial. We showed reductions in perceived stress by the end of the 6-week program that were maintained at the long-term follow-up, whereas the controls didn't have that improvement. And we also saw a trend towards improvement in resilience in the long-term follow-up in the yoga group, but the non-yoga group did not see those kinds of improvements. We also saw improvements in mindfulness, again, that were sustained at the long-term follow-up in that population. Then we also took this to physicians, and these are Harvard physicians based at Brigham and Women's Hospital. This was a 6-week program that was delivered at the hospital, and we were very interested in looking at burnout itself. And we did see reductions in the single group trial in scores of burnout at the hospital after the 6-week program. And 2 months later, those improvements appear to be maintained. And then on subscales of the burnout questionnaire that we applied, we showed reductions in work exhaustion, improvements in interpersonal disengagement, and improvements, at least at the end of the program, in professional fulfillment. We also saw reductions in perceived stress, improvements in resilience, and then also improvements in mindfulness. And again, these improvements in mindfulness, we believe, are mechanistically tied to these improvements in resilience and perceived stress. And we took this even to a more stressed population, which are physician residents. And these are also Harvard Medical School residents based at the Harvard hospitals in downtown Boston. And the total burnout scores, this was a randomized control trial, were reduced at the end of the program and maintained at the long-term follow-up. There were no significant changes in the controls. And then we also showed nice declines in the subscales of work exhaustion, physician well-being, improvements in physician well-being, and then also reductions in interpersonal disengagement. So again, showing positive benefit. And when we also looked at perceived stress, resilience, and mindfulness, again, we saw what we saw pretty much with the physicians. The perceived stress was reduced, resilience increased, and mindfulness was also increased. So I work closely with the International Association of Yoga Therapists, which supports my work and our annual symposium on yoga research. And one of the things that yoga therapists are really good at is applying yoga to stressed populations. And one of the funding agencies for the study was the Kripalu Center for Yoga and Health. We are also funded by the Osher Center for Integrative Medicine at Harvard Medical School for the resident study. And then finally, I'm also personally supported in my research by the Kundalini Research Institute, which supports the style of yoga I practice. So that's my presentation. And what I'm going to do now is turn it over to Dr. Rothenberg.
Thank you very much, Dr. Khalsa, for that absolutely wonderful presentation, comprehensive presentation. I'm going to pick up from there and share my screen, and I'm going to be focusing on the meditation component of yoga. So the system of meditation that I'll be speaking about is Transcendental meditation, which has been used now extensively among healthcare workers, and particularly frontline healthcare workers, since the onset of the pandemic. And this is called the Heal the Healers Now initiative. It offers transcendental meditation for healthcare worker well-being and resilience. I'd like to start by defining resilience, and this is from a well-known definition by an expert in the field, Dr. Ronald Epstein of the University of Rochester. He defines resilience as the ability of an individual to respond to stress in a healthy, adaptive way, such that personal and professional goals are achieved at minimal psychological and physical cost. Now, in healthcare workers, particularly frontline workers, stress just comes with the job. It's almost a continuum. So if we're going to protect and preserve the mental and physical health and well-being of healthcare workers, we need to attend to and enhance this dimension of resilience. To give you a little overview about the Transcendental meditation technique, it's a mental technique to reduce stress and improve resilience. It comes originally from the ancient Vedic tradition of India. It was brought to the West in the late 1950s. The first published research on the technique came out about 10 years later. I'm dating myself, I was a medical student at New York University School of Medicine at the time. These first studies were coming out in the period of 1970 to 1972 in Science, American Journal of Physiology, and Scientific American. To date, there are over 420 peer-reviewed studies that have been published on the technique. Over $330 million in grant support has been awarded by the National Institutes of Health and the U.S. Department of Defense. TM is not a philosophy, a religion, or belief system. It's a mental technique, and it's easily added to daily routine without changes in mindset or lifestyle, which makes it particularly easy to integrate in a well-being program for busy healthcare workers. It doesn't require concentration, contemplation, and actually the mechanics do not involve mindfulness, but rather what they do involve is what's called transcending. And transcending, I'll describe more in a moment. It's where the practitioner experiences progressively quieter, less excited states of mental activity, resulting in the experience of what's called restful alertness. So in this, I want to go back to the concept of yoga and tie back to some of the concepts that Dr. Khalsa was speaking about and relate yoga to the element of resilience. So the actual meaning of this Sanskrit word yoga is in English union or integration. And as was said, the ancient texts of yoga describe it as a state of complete mind-body balance. But principally, they locate the source of this balance within the mind, within what we can call consciousness. So here on the right, we see a definition from the Patanjali Yoga Sutra, which is one of the most ancient written texts on yoga. And in the Sanskrit, it says, Yogaschita Vridhi Nirodha, which translates literally in English as yoga is the complete settling of the fluctuations of the mind. Or we could say alternatively that yoga is the least excited state of consciousness or pure consciousness. Now, the Transcendental meditation technique, which derives from the yoga tradition, is a procedure that allows the mind to settle inward to experience that silent state of pure wakefulness within, as you can see diagrammed here. This is focusing on the mechanics a little bit more. So what happens during practice of the technique, starting at the active thinking level, which we are all in now, presumably, where the mind is busy, is thinking, we're perceiving, we're getting new information, we may be having memories and so forth. Very active, like on the surface of an ocean, where the ocean is very wavy and very dynamic. However, from time immemorial, the ancient tradition of meditation has described that there are layers within the mind, that within the mind, there are more serene, more refined, and quieter layers. And this is called, accessing this is called transcendence or transcending. And so what happens during TM, by application of this specific technique, it allows the mind to turn easily within and to experience more refined, more settled levels of activity, and ultimately coming to the most refined, level of activity, transcending even that to experience the least excited state of the mind, which was described on the previous slide, that state of pure silent awareness, which the scientists called restful alertness or pure consciousness. And then practicing this regularly, the TM program recommends practice of the technique 15 to 20 minutes twice a day. It's done sitting comfortably in a chair. One would like to be, no particular rules about the postures or dress or anything like that. But over time, when one is doing this on a regular basis, then the benefits of having this experience of deep internal rest and also expansion carry over more and more into daily life. So one of the first studies that were done on TM, and this goes back to the original research, although this is a meta-analysis of a lot of these studies published later in 1987. But what they all found is that during the practice, there are distinct physiological changes that are the opposite to the fight or flight stress response. For example, during the 15 to 20 minute meditation period with TM, the respiratory rate goes down, the heart rate goes down, blood pressure goes down and stays lower after meditation in people who are trending towards high blood pressure. Muscle tension goes down significantly as a state of very deep relaxation, and perspiration goes down, also a sign of deep relaxation. Another finding from the very earliest studies, this was from University of California at Irvine, published in Hormones of Behavior in the late 1970s. This was a study on cortisol. This has been replicated many times. So cortisol is one of the body's principal stress hormones. Decrease in cortisol is a good physiological marker of decreasing stress. You see here the control group at the top were not meditating, no change in their cortisol levels. The middle group were short-term meditators, 6 months or shorter, practicing transcendental meditation. And you see already during the practice, cortisol levels going back down about 12% and then staying low afterwards. And then the longer-term meditators, 1 year or longer, you see more profound decreases of cortisol during the practice, about 30%, continuing low afterwards. And follow-up studies have shown that baseline cortisol levels in TM meditators are at baseline outside meditation, 30 to 40% below the general population. And that has tremendous health implications because it's known that chronic stress producing chronically elevated cortisol is associated with increased atherosclerosis, coronary heart disease, diabetes, obesity, some forms of cancer. So reducing these levels is very, very valuable for long-term health. Now I want to turn to the neurophysiology of the brain. This is very important and actually kind of unique research that's come out of the neurophysiological studies on TM. And this was found early on in the mid-1970s and has been replicated many, many times. So using the EEG, electroencephalograph, to look at what's happening in the brain during the TM practice, what was found early on is that there are periods of intense coherence. Coherence means that the brain is producing, different parts of the brain are producing the same rhythm, the same brain rhythm. So you can see here in this tracing inside the blue oval that every one of these leads, which is across the entire brain, is showing the same frequency and same phase relationship. So this indicates a high degree of orderliness that exists within the brain. And during the 15 to 20 minute TM session, the brain cycles in and out of this state. And subjects are asked to push a button when they have the subjective experience of inner wakefulness or unbounded awareness or transcending. And when they do that, it correlates very strongly with the physiological finding of the EEG coherence that you see here. So we can think of this as yoga in the brain. This is integration, or as Dr. Khalsa said, a unitive experience shown in the functioning of the brain. It's a high degree of integration in the brain, and this is at the basis of many of the positive health benefits that result from the TM practice. Now, there is a principle that has become popular in neuroscience, which is that, speaking of the brain, cells that fire together wire together. You may have heard this. So the regular experience of this state of integration of EEG coherence results in increased connections within the brain, increased connectivity within the brain. The brain capacity increases, and this has a direct bearing on improving cognitive function, emotional balance, and also resilience. This is a study, a randomized controlled trial, was done on 210 high school students at an age beyond which when intelligence should be thought to be increasing. And the average duration of practice of TM in this group, this was a randomized controlled trial, was 6 to 12 months. So compared to controls, highly significant increases in creativity, field independence, practical intelligence, mental efficiency, and fluid intelligence, which correlates with IQ. At the other end of the age spectrum, this was a study done at Harvard in nursing homes in the Cambridge, Boston area, randomized controlled trial in which these subjects, who were all between the ages of 80 to 84, were randomized to 4 different groups. You can see on the left, the TM group had significantly greater success in improving cognitive flexibility. So this was a test of cognitive flexibility. Cognitive rigidity generally goes along with aging. People get more rigid in their ways of thinking, rigid in their habits. Cognitive flexibility is more associated with youthfulness, cognitive youthfulness. So this is what's developing. And this goes back to that yoga in the brain, the integration happening in the brain. And to some degree, the other 3 techniques show this, but to a lesser degree. For example, the group randomized to mindfulness, to the relaxation response, or to no treatment. So I want to relating this to healthcare workers, and I'm going to come specifically to that work in a moment. But healthcare workers need improved cognitive function, and especially cognitive flexibility. It's an immense value for us because we're constantly called upon, or frequently called upon, to make important, rapid decisions regarding patients' health. And that can be a very stressful experience because it's happening all the time. But having a high degree of yoga in the brain supports a higher level of brain functioning, which allows such decisions to be made in a much more effortless, fluid, and stress-free manner. That means an enhanced level of resilience. The extreme level of anxiety and psychological disturbance is found in PTSD, and the most extreme versions of this are found in our military veterans and first responders. However, research has shown, and some of our research as well, a fairly significant level of PTSD in many healthcare workers as well, especially frontline healthcare workers. This was a randomized controlled trial done at the San Diego VA Medical Center, supported by a grant from the Department of Defense. 210 veterans with severe PTSD randomized to either learn Transcendental meditation, participate in the military's gold standard program, which is prolonged exposure therapy, or just be in a health education control group. And you can see here there's a 3-month trial. You can see the 3 triads of bars. The one on the left and the middle are looking at severity of PTSD symptoms. On the left, it's through the CAPS interview. That's a interview done by a trained clinical psychologist. It's considered the best way to measure PTSD severity. The middle is the self-report PCLM checklist. And then on the right, depression scale using the PHQ-9 depression scale. And you see the same distribution in each of these outcomes, where TM significantly greater effectiveness as defined as clinically subjects with showing clinically meaningful improvement in the 2 PTSD measures and in the depression measure as well. A series of 10 trials funded by the National Institutes of Health have looked at the impact of Transcendental meditation on heart health and cardiovascular risk factors. This is one of those trials. It was done at Medical College of Wisconsin, a 5-year study on African Americans with diagnosed coronary heart disease, looking at the incidence of heart attacks, strokes, and death in this very vulnerable population. Subjects were randomized either to learn Transcendental meditation or to be in a health education control group that was matched for time and attention with the TM practice. And you can see at the end of the 5-year period, there was a 48% lower rate in the TM group of heart attacks, strokes, and death as compared to the health education control. So that's a very robust finding, a very important finding, since cardiovascular disease is still the #1 cause of mortality in the US. Other studies in that NIH supported series looked at the impact of TM specifically on blood pressure in people with hypertension, and they show consistently that TM lowers blood pressure in people who are hypertensive and prehypertensive. So the American Heart Association acknowledged this in a scientific statement where they said that TM may be considered in clinical practice to lower blood pressure. And they went on to say that other meditation techniques were not recommended in clinical practice to lower blood pressure at that time. So now I want to just tell you a bit about the Heal the Healers Now program. This was launched in April 2020 when the impact of the COVID pandemic was just beginning to be appreciated, the impact on healthcare workers. And it was launched on Good Morning America. You see that at the lower left, that's Robin Roberts. She was the co-host who did that segment. And as a result of that launch, there was a tremendous wave of interest in the program, and it got off to a very strong start. It provides TM instruction and follow-up for frontline healthcare providers and workers. Programs at this point have been implemented in over 90 hospitals and medical centers nationwide. 8 of those include formal research studies, 7 of which have been published. The 8th is now in review for publication. The ones who have been published were done at Brigham and Women's Hospital at Harvard, Duke Medical Center, University of Michigan Medical Center, the Moffitt Cancer Center in Tampa, a Miami multi-site hospital study, and at Loyola University Stritch School of Medicine. This is the Duke study, a randomized controlled trial with 80 subjects, 40 randomized to learn TM and 40 were in a treatment as usual control group. This is looking at the Maslach burnout inventory. The emotional exhaustion scale felt to be the most highly correlated with burnout. And you see the significant difference between the change in the burnout scale in the TM group as compared to the TAU group, treatment as usual control group, much higher degree of reduction in TM group and very high degree of significance. Again, from the Duke study, anxiety on the left, insomnia on the right, anxiety with the GAD-7 and insomnia with the insomnia severity scale. You see again that same distribution, this very significant difference in the 2 groups, the TM group, much greater reductions. This is the Brigham study. And the Duke study was published in JAMA Network Open in the fall of 2022. This study at Brigham, which was published, this was all among emergency physicians and nurses in the emergency department at Brigham. This was at the height of the pandemic in Boston, when these folks were the most challenged and vulnerable. And this, the measures were taken at baseline, 1 month and 3 months on these clinicians. You see on the left depression, on the right anxiety, the very significant decreases with strong effect sizes in depression and anxiety. Similarly, perceived stress on the left, sleep disturbance on the right. And then what the investigators in that study did was they wanted to ask the question, is this really feasible and acceptable for these highly busy and challenged frontline healthcare workers? So they constructed a specific questionnaire for that. And the answer turned out to be yes. 90% of the emergency clinicians were compliant with the instruction regimen. 85% were regular with their TM home practice, when defined as practicing at least once a day. 93% said they would recommend TM to a friend, and similarly said that TM was helpful during COVID. And when asked if they plan to continue regular TM practice, 80% said yes, and 20% said maybe, and none of them said no. And this study was published in the Journal of the American College of Emergency Physicians, Open in December 2021. This is the Miami multi-site study. Miami was the epicenter of the COVID pandemic for a while, and this study was conducted at that time. This is a controlled trial, with matched controlled trial with 130 subjects, 65 learned TM and 65 were in a matched control group who were not instructed in meditation. And these were healthcare providers at 3 large Miami area hospitals. And you see the purple line at the top. These are the controls: life as usual, treatment as usual, no significant change over 3 months. The TM group, the green line, you can see the very rapid improvement in anxiety, dropping by about 50% after only 2 weeks and continuing to decrease at 1 month and 3 months. So that indicates the rapid onset of the improvement with the TM program. A mirror image outcome looking at mental well-being. Here we see the increase in the TM group and the no change in the purple line at the bottom of the control group. And again, at 2 weeks, very significant improvement in mental well-being, continuing to improve as the study went on. The last study that has been done that's in review for publication was at Georgetown University with medical students. This is 40 medical students from across all 4 years of the medical school there. Again, measures at baseline at 1 month and 3 months. You see, again, using the Maslach Burnout Inventory Emotional Exhaustion Scale, very significant improvements at 1 month and more so at 3 months in these medical students. And then on the left, anxiety with the GAD-7, and then resilience on the right with the brief resilience scale. You see anxiety trending down and resilience improving significantly as well. And the last slide I wanted to show, and this I'm not, in view of time, not going to go into detail. This was very recently published. It's a qualitative study on advanced practice nursing students and faculty at the University of New Brunswick in Canada, 11-month study. So this was not quantitative, but it was structured journaling. And then the journal entries were analyzed and for their content. I'll just read, let's see, I could just read the first one. The benefits of this meditation practice far exceeded my expectations. I assumed I would feel calmer, maybe more focused or well rested. While those things did occur, they were the result of something greater. I found that through taking the time to sit alone in silence with myself, I was able to get to truly know myself in a way that I wasn't aware I hadn't. And then the last one, I thought this was very interesting in light of our topic today. Doing TM immediately following yoga is a great experience. The yoga seems to prepare me for TM and get focused quicker and more deeply. The two practices together have an additive effect, which is beneficial for my mind-body health. The last slide I'm not going to cover now in the interest of time, maybe in the Q&A. Oh, I'm sorry, this I do want to mention. That it aligning our objectives with the Total Worker Health Initiative of NIOSH, the program, the Heal the Healers Now initiative, incorporates advocacy in every hospital in which we are active. So we advocate with the leadership, for example, to provide quiet time rooms and protected time breaks during the workday to allow the staff to learn and practice TM while on shift, at least one of their 2 TM sessions, to be able to do that at the workplace. We engage with the leadership to themselves participate in the program, which strengthens their own advocacy, bringing it to the workforce. And then we are in the process of assessing the economic impact beyond these impacts, the economic impact of the program on the institutions, parameters such as staff satisfaction and performance, absenteeism and turnover, as well as on individual healthcare utilization and costs. And also the program organizes scientific and professional conferences to educate leadership, staff, and the broader community about the evidence for the benefits of the program, including alignment with the NIOSH Total Worker Health Program. So I'm going to stop there. The last slide, which I won't cover, has to do with the course structure for learning TM, and if it turns to be relevant during Q&A, I'll cover it there. So turning it back over to Sarah.
All right, well, thank you both so much for your presentation. We're getting a lot of claps and hearts coming through in this reaction. So we'll go ahead and get started with the Q&A. We have a lot of good questions coming in. So let's see. One question that we have says, does the content of the yoga sessions or type of yoga make a difference? One more focused on the physical exercise versus putting more emphasis on the meditation or spirituality side? I think Dr.
I would say yes. And usually this question comes in the form of what's the best type of yoga to practice. And the answer to that I like to give is do a practice that incorporates more of those four components. So if you're going to select a yoga practice, don't just go for just a physical practice, just the physical postures and exercises. Try and find a style of yoga, and there are many, that incorporate to some degree all of those four components, because that's going to give you more likelihood of getting benefit, because each one of those practices has benefit, but it also allows you to gravitate towards that component of the yoga that resonates with you. And that's important for engagement, because if you end up doing some slow breathing and you find that you really, really like slow breathing, you know, mind body medicine doesn't work if you don't practice it, if you don't do it. So engagement is absolutely critical. So giving people that sort of wealth of different types of mind body practices as we get in yoga is important. So that's why I always recommend a style that is more traditional. And there are some meta-analyses that are now starting to show, for example, studies on hypertension, that those yoga styles that incorporated more of the meditation and breathing as well as the postures seem to be doing a little bit better than those that are much more focused just on the physical practices.
Great. Thank you so much. All right. Dr. Rothenberg, I believe this is for you. Someone asked, how long does it take to get into a transcendental meditation state?
Oh, okay. Well, so how long does it take to get into the state? It generally happens in the first session. So that, for example, that signature EEG coherence I was talking about, and by the way, that for those who are interested in, that's in the alpha 1 frequency. This is the signature of the EEG in TM. It's a slow alpha, which is 8 to 10 cycles per second. That happens immediately. It's been shown that even within the first session. So it seems to be that it's just this transcending mechanics is innate to the human brain, and it's just has to be unlocked through this specific procedure. What does change, and all that coherence that was shown can happen right away, and often does within the first few days or weeks. What changes over time specifically is what happens outside meditation. In other words, the effect on the brain, and this has been researched also, that this degree of integration of the brain, what I'm calling yoga in the brain, is spilling over more and more into activity. For example, there was a study on 300 students in American University in Washington that showed that just before final exams, when you'd expect them to be most stressed, they scored higher on brain integration using the EEG measures than a randomized control group, the TM group, did. And that was outside meditation, that was doing math puzzles. So it's over time that changes, begins to spill more and more into the brain functioning. I want to just mention, because you said, how long does it take? There are 4 sessions to learn Transcendental meditation. That was on the last slide. And they're each 1 hour long, and they're done on 4 consecutive days. And the first session is always one-on-one personal instruction with the teacher. Everyone has a little bit different way of experiencing this transcendence in the very beginning. And so the teacher acts as a guide, personal guide, during the first session. And then sessions 2, 3, and 4 reinforce the experience over 3 successive days. And those are done in group formats.
Wonderful. Thank you. Okay. I believe that this next question is for both of you. It says, how do you recommend employers implement these interventions without making it seem like burnout is an individual problem that employers have no responsibility for? Dr. Khalsa, I'll go to you first.
Yeah, I think this is a major issue, especially in modern medicine. The modern US medical system is in a state in which it causes, it's a major cause for chronic stress and burnout. And so clearly the system needs to be changed to reduce that very, very high stress burden in the system. Having said that, medicine is a stressful occupation by definition. You're dealing with people's lives on a day-to-day basis. And so it's incumbent upon those people that are training medical students and physicians to not only train them in the skills of medicine, but train them to be resilient, to give them the skills that are necessary to cope with a stressful occupation. So yes, I think both need to happen. We need to have these mind-body practices implemented in training medical students and physicians, but we also need to have a system that is not causing excessive stress. And there is some pushback actually from physicians when they say, the burden's not just on us. It's not just that we're non-resilient. It's not just on us. It's on the system. And I think that's a valid complaint on the part of these individuals. But in terms of employers suffer as much from the burnout as the workers do, because burnout causes a lot of corporate issues. I mean, there's loss of productivity, there's a lot of job turnover, there's a lot of illness, and there's there's even intersocial violence in the workplace. And I think that so employers are really motivated to try and address this in their workers to make their company more productive and livable, if you will. So I think the burden is on both the system to change, to accommodate and manage less stress, but also to make sure that the employees have access to these mind-body practices, which are really effective in managing stress and improving resilience.
Thank you. And Dr. Rothenberg?
Absolutely echo what Dr. Khalsa is saying. It's been our experience when we introduced the program Heal the Healers Now to a hospital. We always engage with the leadership on this issue. We see ourselves as part of this army to make this happen, because it's clear that this program and programs like it, they work much better if the administration is supporting it, and how they signal their support is by letting the healthcare workers do this on the job, that they're getting paid to do it and providing the space to do it. So I won't say that we've been in any way universally successful, but we have had some success. And every time we have that success, we feel that we're optimistic about this, because, as was said, the system just isn't working the way it needs to now. And it's not self-sustaining to be burning out our healthcare workers. So I think increasingly leadership is understanding that, and particularly when they themselves adopt these practices, this is when we see change really happening and motivation coming from the top to change the culture of burnout to a culture of well-being, and really support the staff to be able to unfold their own potential for well-being.
That's great. Thank you so much. That's so interesting. Okay, this is interesting. Just in the last minute here, someone's asked, just as it's recommended that we physically exercise for, let's say, a total of 150 minutes a week, is there a recommended amount of meditation per week that we should implement to stay healthy? I'll go to Dr. Khalsa first.
Well, that's a complicated question with many complicated factors. It depends upon the individual, depends upon their life circumstances, how much they need to benefit from the yoga practice. But, in terms of a yoga practice, for example, it's hard to quantify it. It's bigger than a bread box, but smaller than a semi. And so if you're talking about in terms of how many yoga classes should I practice, my experience has been, one yoga class per week, probably not enough to give you a really palpable improvement. 2 yoga classes per week, 2 hours per week, then you start to feel the change. You start to feel it. And then 3 classes per week, you really start to feel the change. So the more you practice, the better you are. Many people really advocate a daily practice. But we live in modern society, and if you have to go to the yoga class, you have to make time out. You have to travel there. You might have to have childcare. So it's a challenge. But the more you can do, especially if you learn from a teacher, and then you can take it online. You can take it to a DVD. You can take it to an online class, and then practice at home. So the more you can practice, the better.
Thank you. And Dr. Rothenberg.
Well, with this program, Heal the Healers Now Transcendental Meditation, it is a very specific program. It's 15 to 20 minutes twice a day is the recommendation. But the data that I showed you, the criterion for regularity was once a day practice. So all that, the reduction in heart attacks and strokes and blood pressure and burnout and so forth is really based upon even that. Although it's been shown there's definitely a dose-response relationship. For example, with the Georgetown medical students, the students that were doing it twice a day or closer to twice were definitely getting better scores on the burnout and so forth and resilience. That said, once a day definitely has an effect. As one continues with the practice, if one wants, there are steps up. There are advanced programs in which one could practice more. But in general, it's a balance between meditation and activity. It's not the case, at least from this understanding of this program, that the more meditation, the better. Not at all. It would be like saying the more ibuprofen you take for your joint pain, the better. No, there's a recommended balance there, and the balance is between meditation activity and basically it's 15 to 20 minutes twice a day.
Okay, that's wonderful. Thank you both for all of your time, and thank you for hanging on a couple of minutes post 3 p.m. for us, at least. We really want to thank you for your time, for anyone who has joined us today. We are out of time now, but a big thank you to our speakers, and we invite you to stay connected with us through our website, social media, and to sign up for our Total Worker Health in Action newsletter for the latest information on our program and our partners. And with that, we will go ahead and end the webinar. So thank you very much, everyone, for joining today. Have a great rest of your week.